I'm going to continue the conversation about coping with COVID-19 on contact professions. And today we're talking with a dentist because that is a contact profession, Dr. Dian Kunulal. Good morning.
Good morning.
Welcome to the program.
Thank you.
Yes.
Thank you for having me.
And, we spoke about optometrists, ophthalmologists who really touch the face. And so we spoke to cosmetologists and makeup artists and so on. But with the dentist now, you really get in there and you're exposed to fluids and so on. What is the fraternity doing?
Well, the Dental Association and Dental Council has issued guidelines, which we have sort of started to implement even from the first occurrence of these things, even before it even got here.
Yes.
All right. Now, in order to fully understand how to manage, we have to understand how it is that this virus moves from one person to another. All right. And that is through saliva and through contact from one person to another. Right. And the way it happens is not the way some people think. It happens from the saliva moving from one person through what we call the mucous membranes of another person. Right? Those mucous membranes, all right, are found in the mouth, in the nose, and in the eyes. All right? So someone coughing, sneezing, droplets of saliva ending up on your hands does not go into your oral cavity just like that. You have to put it there.
Right.
All right.
Which is why they're encouraging us to wash and sanitize our hands and prevent yourself from touching your face, which is a difficult thing for most people. Yeah.
Yeah, because it's voluntary in a lot of cases. So what as the profession, that deals a lot with saliva and in the oral cavity, where the virus is so much of an issue. All right, what we have been doing as one, trying to keep the virus out. All right, so we have been started screening patients. All right, those with a travel history and so on. Cough and so anyone who might be more at risk, and asking them to defer procedures if it is that it can be deferred. All right, emergency cases we continue to see. All right, and the ones that we continue to see, we have to protect. We have to protect other patients, and we also have to protect ourselves and our staff. Okay, so we have implemented some measures which were already in place for infection control, but with a few added measures. Surgical gowns, right? These are full gowns that cover the whole body of the attending dentist and assistant.
Right.
The N95 surgical masks, face masks, right? Which have become very, very scarce. Eyewear. Worldwide.
Yeah.
Worldwide. Eyewear, goggles, and even face shields. Right.
Okay.
Right. But even with all of that, especially with the dental profession and especially with the instruments that we use, we tend to use instruments that will produce not just saliva produced more by a patient, but also aerosol of saliva, which would fill the room. So we added other measures like improved ventilation and so on where possible, opening windows and allowing the aerosol to dissipate. But even with that, the dental profession is at an extremely high risk, of the highest risk that there is.
And have you seen persons voluntarily canceling? Has it affected the profession as well from an economic standpoint in terms of persons saying, this is too risky for me, I am going to postpone what I have to do?
Right. Well, from an economic standpoint, yes, we have had a reduction in patients wanting to do procedures, but also from our end, us canceling patients that we don't necessarily need to see at this moment.
Yeah.
But at the same time, keeping the ones, because it is an essential profession, keeping the ones that are emergency procedures and so on. All right. But added to that, there's the added cost that we have incurred in protecting ourselves, protecting our staff, and increased sanitation and so on to protect our patients also.
And you mentioned something that I didn't even think about, which is the aerosol effect of the spraying of the saliva around the room and so on. And they're encouraging us now to use a tissue to hold door handles and so on. If it's going to be spraying, is it that in the practices you would have to sanitize all the doorknobs all the time because you don't know where it would land?
Well,
the entire office, so to speak, not just the space,
not just the space
that you with the chair and so on, but the entire office.
Well, I mean, to a certain extent, these procedures were already in place, but a bit more so and a bit more stringent and a bit more attention to detail. But yes, we've been doing that, and even the general patient areas where before they actually get into the room, sanitation has been done and has been doing in other fields also.
Yeah, not every cough is COVID, and we have to remember that, right? What are you saying to your patients? Is it that if you have the flu, if you have symptoms, but it may not necessarily be COVID, to stay away, or when you screen, if the history is of asthma or respiratory problems, that bronchitis, for example, you would still see patients. What is the advice to the viewers?
Right. So the thing is, as you rightly said, not every cough, and we've had patients daily come in, but because we sometimes would know their history, and we if it is that we see someone presenting with a particular history, we would isolate that person within the office and have a dentist. We'd have one of our dentists do a screening to see just how at risk the person is. But at the same time, we have taken an oath to to treat persons, and we can't leave them and not treat them because. So it's a bit more measures that and a bit more precaution that we would take for such patients. In some countries, I believe in I think in the UK, I think they actually have specialized centers where they especially for dental patients who might have COVID.
Okay, which is a valid question, because if you have COVID but you need procedure, what happens in a case like that? So in Trinidad and Tobago, well, we don't have that situation as yet, I'd imagine. But you're seeing in the UK, they've actually established particular centers.
Well, yes, but in those areas, those are areas where the prevalence of the virus is a bit more rampant. Also, but for now, what we do is as I was wondering, we took an oath, that's our job, and we have to see these patients regardless. We just put extra precautions in.
All right. Well, Dr. Dion Kunulal, thank you so much for clearing up some of the questions that I'm sure many of you out there have been asking in your mind, and that's what we're doing this morning, providing you with information. Dr. Dion Kunulal, dentist, and just giving us some assurances there with regard to another contact profession. And that's what we're going to be doing over the next few weeks, as we talk about coping with COVID-19.